what advice do you have for newly graduate doctors of physical therapy as they start to enter the work field?
Perfect timing of this question. I'm guessing that Timothy's getting ready to graduate, and that's why he's wondering that. And I feel like every time I answer this, I have a little different of an answer.
Oh, yay.
Because you get more experience, and I like to think that with the experience you get wiser, but not every experience leads to more wisdom. But I would say that my advice would be that you're going into a field to help people, which requires sacrifice. And to exercise sacrifice, you have to understand what love is. And to understand what love is, you almost have to detach or die from yourself in order to do that. And the reason that I say that is that with our clients, within our families and some health struggles, we've just realized how poor the delivery is of bad news in the healthcare field. Of people coming in and going, oh, good news. It's not this type of cancer, it's this type of cancer. Like, okay, from the science, like, you're right, like, this one is more treatable, and that's a great thing. But that's not how you deliver it to a person.
Yeah.
But the reason that it's delivered that way is because the person's excited because they figured it out. They were the ones that found that. So now their ego is fulfilled because what they did was the right thing. They found it. They're saving that person's life. And what they forget is that this is a person in front of you. And at some point, yeah, they're going to be excited that you were the one that found this out for them. But the way that you deliver that, you have to die to yourself and your ego of, oh, with all my schooling and all my education, I'm the one that found this diagnosis, and I'm the one that helped to save your life. Like, great. Congratulations. But what did you just do to that person from the way that you gave that to them? So yes, you need the knowledge and you need the test, and I don't want to take anything away from the knowledge of these providers and the things that they are doing to save people's lives. But I think if we all just died a little bit to our egos and got back to the fundamental principle of caring for one another, we'd be able to make these diagnoses and deliver them in the way that is delivered with love, instead of getting what people are getting now, which is a provider giving them a horrible diagnosis with excitement because they found it. I think if we all spend time changing our mindset from trying to be right and putting our efforts towards trying to be a little less wrong, then we can serve people much better. And you may hear that and think, oh, there's not too much of a difference there. There's a huge difference, and that difference is humility. So I think that would be my answer at this stage in life right now.
I love that answer, because my answer, although I'm not a DPT by any means, was going to be like, remember that these people are human. Mm-hmm. And going off of what Dylan said, like, I really think that people in the healthcare field, and maybe even other fields as well, should have to take continuing education courses every year that are strictly for interpersonal communication and how to treat a human, because it gets lost somewhere. And I think that now more than ever, our society is struggling with how to communicate and how to care for the person next to them or the person that they're providing for, and maybe even vice versa. And so, like, I absolutely love your answer of like love and humility, because it's putting yourself like back in order to serve the person in front of you, and it's caring for the person, not the injury, not the shoulder, not the whatever, but the person as a whole, because they are a soul that deserves to be cared for.
Absolutely. And don't, like, to that point, like, the common thing we hear is, oh, we got an ACL back in room 3.
Oh, I hate that.
Well, you better put that ACL on ice or something to preserve it, because why is there just an ACL back in that room? Like, oh, you mean a person?
You're so funny.
A person that has a name is back in that room? Oh, okay. Like, let's go see that person. Like,
Yeah.
why do we say, oh, rotator cuff back in room 1? Like, what is it, a pro section? Like, what is this thing? But the last point I want to add into is, if you're starting to overcomplicate things, and the reason I say this is because I went down this path of overcomplicating things and giving these, what I will now call egotistical answers on what is going on and creating the person's response to that stimulus, also known as a diagnosis, got super complex. And I realized, like, what is that complexity serving? Because it's not serving this person in front of me. When I got back to simple, that served this person much, much, much more. We spend so much time, is this a supraspinatus injury? Is this an infraspinatus injury? Is this a labral tear? Is this a biceps tendonitis? Is this a capsular issue? Is it this or is it that? And we forget to ask, hey, what is it that you want to do that you can't do right now? What's the threshold that you're able to perform right now? Not even in a weightlifting sense or a competitive sports event, but like, well, I really want to be able to lift my coffee cup up to my mouth, and that kind of brings on these symptoms of pain. All right, cool. Well, there's a great goal for us to have. Let's work on some things that we find, and then let's make that our goal. Well, what's going on with my shoulder? Well, what's going on with your shoulders? You can't lift the coffee cup. And, you know, you have to do your due diligence to make sure that it is something that you are the right person for them to be seeing. And if it is a full cuff tear and there's no likelihood that this person is going to get back to the activity that they want to get back to unless they do have a surgery, well, that's a different story. So do your due diligence, rule some of this stuff out, but then get back to being simple. Like, what is that complex diagnosis for that person for? Half the time they can't even say the diagnosis.
Yeah.
Like, oh, what's going on with shoulder? Well, it's that old rotor cuff injury. I said something about a spinatus. Like, who is that answer for? Like, we're just trying to fulfill our ego that we like did all this anatomy, have all this knowledge, which is great. Like, that's great. Like, we should have that knowledge. But let's leave that complexity, that detail of a conversation for our colleagues and our mentors and student-teacher interaction versus saying it to a patient who just wants to know, am I going to get better? Am I in the right place? Can I get back to these activities? Do I need to change my career? Like, that's the answers they want, not these fancy names that are just going to create fear and they're going to go on Dr. Google and get more afraid of it.
Yeah, it's a gift to be able to communicate to someone the way that they need to receive it as opposed to the way that you want to communicate it. And I think especially as a provider, that's important, of how can I communicate so this person can receive as opposed to how can I communicate because I have all this knowledge, you know. It's really putting the other person first of how can I really receive, or how can they truly receive this?
Right.
So
yeah, I'm gonna give a quick example.
Go for it.
And because I'm just in the PT brain
yeah
right now. Right. So
Dr. Man.
we spend all this time learning these shoulder special tests. And this one's supposed to help identify that it's a labral issue. This one's supposed to identify that it's a rotator cuff issue. And the test properties of these tests are not that great. And we've talked about it before on one of these episodes at some point. Right. So do these, a common thing I have with PTs that have graduated who are now getting mentored by myself. You know, we'll have these conversations. I learned 70 special tests with a shoulder. When do I use them and why do I use them? What do I do with those things? Like, okay, well, what are we ruling out? What are we ruling in? And what are the test properties? The test properties for the things are not that great. What we're trying to figure out is, are we appropriate to see this person? And then 2, where's our starting point? We know what the finishing line is going to be, but where's our starting point? And for our starting point, we need to have threshold testing. Are they compression sensitive? If they put their arm onto the ground and put weight into it, does that create symptoms? Now we know, okay, that's compression sensitivity, which gives us more likelihood that it is a labral type of issue, but it doesn't mean 100% that it is, because you could have biceps tendonitis and still have that. You could have a rotator cuff tendinopathy and still have that. But at least now we know that you're compression sensitive. So now we have to ask, well, do we lean into that? Do we use graded exposure with compression? Or do we need to respect it, stay away from it, calm the tissue down, and then work back towards it, right? Okay, we're gonna do some strength testing. We're not doing strength tests just to strength test. Well, let's do strength tests to figure out where is the starting point for this person. Let's switch it up and go to the back. I have a back injury. Just because they lean forward and their back hurts doesn't mean that it's a herniated disc. And there was a recent episode on a podcast, so I won't say the name, but I'm pretty heated about that they only use the biomechanics of the spine and we're referencing these types of things. Oh, you have a disc injury. That means you go into spinal extension to cure it. There's evidence showing that when you go into lumbar flexion, that some of the lumbar disc actually move forward, which is opposite of what the McKenzie method would be saying. So like, test for the threshold to figure out what is the starting point for this person for us to move towards where we want to go, right? They move into flexion, they only can reach towards their knees. Okay, there's our starting point. Then we choose, do we want to move forward further into that, or do we need to respect that for right now, go do some other things, come back and then see how that changes. So for our testing, again, don't overcomplicate it with all these medical diagnoses and all these things. Rule out what you need to rule out, but then let's figure out what is the threshold that this person can tolerate, and then let's use progressive overload and graded exposure to get them to where they want to be.
Awesome. Timothy, we hope that as you're entering into the work field that you can remain encouraged and remember your why, that you remember why you became a doctor of physical therapy, and that maybe you can share this episode or this video with your fellow classmates, because we hope that these simple things, both the technical things that you were just talking about, but also just the simplicity of treating your clients as humans, as people, caring for them as people, like that's going to go a long way. So please share this with your colleagues and with your classmates.